Hi everyone, Michelle here with ASIS Massage Education. So glad for those of you who could join us live, and thank you those who are coming in to watch the recap later in the recording. Glad to have you here. Just as a reminder, I'm here every Friday, Arizona time, with a very special guest each week, talking about all things massage related, and massage therapy, and massage school related. Today's guest, we have Jacki Sellers, who is a massage therapist, specifically an oncology massage therapist and oncology massage educator. She is an NCB-TMB and Society for Oncology Massage approved educator, and she is very passionate about spreading information, awareness about the importance of proper oncology training for massage therapists. And that's every massage therapist, not just ones who want to specialize in this field. So we're going to find out why that's so important to her, how she got started, and how you can find out more information about joining her in some of her classes. So without further ado, let's welcome in Jacki. Hi, Jacki.
Hi there.
Hi. So thank you very much for joining us. I'm happy to have you on.
Yeah.
So I mentioned a little bit that you are a massage therapist and specifically specializing in oncology. But tell us a little bit how you got into the massage field in general. How did that start out for you?
Well, it started out that I was a massage client for many, many years. And here in Tucson, in my other life, I was a professional musician.
Oh.
And I played the French horn in the Tucson Symphony for 25 years.
Wow.
And for about probably 12 to 13 of those years, I was getting regular massage with David Anderson, who started Tucson Touch Therapies.
Yes, I know David.
Yeah. Yes. And so I would see him on a regular basis. I really credit him with keeping my music career going, because musicians are notorious for having all sorts of problems with their bodies. I mean, for brass players, horn players, it's not necessarily repetitive movements like it is for string players or woodwind players, but there's just, you're in a set position for long hours, and it affected me to the point where I was in a lot of pain. And I just loved how I felt when I got done with my massage. And every time I would see David, I would say, thank you for bringing me back into my body. And I was, I had the opportunity to take a sabbatical and also move to California at the same time. And that's where I had my training as a massage therapist. Okay. And that was in 2006.
Okay.
And actually, when I went to California, I was still a professional musician. I was gigging, I was freelancing. And so for a number of years, I did both. Okay. And I like to say that I went to California with 3 horns, and I came back to Tucson with none. After a while, I got so involved with oncology massage and then teaching oncology massage that I basically had a new passion. Wow. And I didn't want to practice anymore on the horn.
Yeah.
So I just kind of slowly retired, but it was very organic and lovely.
Oh, I love that. That's so great. I actually interviewed a few weeks ago, actually, one of our other guests. She's a bassoon player, and she kind of fell into massage very similarly. It's what kept her going. She actually went to ASU for the program. She was a music major, and it almost derailed her because of the pain. So a very similar story. And just thinking repetitive movements in so many different ways can definitely derail people. And I'm glad you were able to continue doing that, the love of the music with that help. So thank you to David. That's really wonderful.
Yeah.
I love that.
He's basically my main reason that I went into it. And before I left Tucson, I asked him, where should I go to school? And I got some I got some good information that helped me decide where I was going to get trained. And I was in California for 12 years, and then I came back. So here I am, and I'm very happy.
I hear that a lot about Tucsonians. It's just, there's something about it. It's just going to bring you back in.
We just can't stay away.
Yeah, exactly. But it seems like you have a really good home, and you're at home where you are. So that's wonderful. I love that. So how did it transform from just a massage therapist, but how did you get into more of the oncology interest? Was anything like a personal connection at all?
Well, what it was, I had been out of school for maybe a year, and I had been working for an acupuncturist, and probably a third of her clients were cancer survivors. Not all were in treatment, but they were survivors, longtime survivors. And I just kept thinking, I think I have to know something else. I just feel like I need to know more. I don't feel like I am very knowledgeable. I felt very conflicted. And that was when I found the course that basically I teach now, which is a foundation course. And it was at the beginning of 2009 that I took that class. And I had already been working on cancer patients. And, I see this happen in my classes a lot. People are like, they hear some information and then they're just, their jaws drop. They're like, oh my God. And, it's like, we've all been there. There's this nugget of information that just changes the way you think about things.
Right. Yeah, absolutely. So is that what inspired you then? I need to teach this to more people, because there's just not, I think from my perspective, I don't think there's enough emphasis on the training other than people who say, I want to travel down this pathway and work specifically with this population, as opposed to really everyone. Is that why that kind of said, I'm on a mission?
Yeah, that's part of it. I have been a teacher for a long, long time. And before I got into massage, I was teaching music. I basically have been teaching since I was 18. So when I was in college, I taught little kids. I taught here at Pima College for 13 years in the music department.
Wow.
And I've just always been a teacher. So it was a very natural progression for me to want to teach. And the organization that I was trained by is a nonprofit in Southern California called Greet the Day. And they offered these spa days for cancer survivors. And it was that all the therapists were properly trained, and they had this whole half day of, yoga or a mindfulness kind of hour. And then they got a massage or a facial. And so actually estheticians, because they do a lot of upper body massage, this is good training for them.
Yeah.
And so it was really through Greet the Day that I got my start teaching. I started out as a TA, like we all do. And it was in 2010 when I went to my very first Society for Oncology Massage conference.
Okay.
And it was there that I thought, I want to do this.
Yeah, I'm going to put that up on here. So that's the Society for Oncology Massage. So is it a professional organization that you join and become a member? Is that?
It's actually, yes, it's actually a nonprofit. And our mission is kind of threefold. It's to support therapists who want to work safely with anyone who's had a history of cancer. It's to set education standards for that training, for a foundation of training and then further classes. And then we're highly into research, becoming partners with different, groups to try and get more and more research behind this.
Right. That's awesome. So do you, is most of the, I know I'm going into that, but is a lot of the funding from that, from the membership dues, or work just
Yes.
working with the other organizations and things like
Yeah,
that?
the membership dues,
Mhm.
and you can become a preferred provider after you've taken an oncology massage foundation class like the one that I teach.
Mhm.
But there are numbers of teachers all over the country teaching this through S4OM.
That's
And
awesome.
just getting that foundation in. And then they have a therapist locator on the S4OM website. So
Mhm.
you can get yourself on there and people can find you there.
Mhm.
It's a great place for resources for anybody, for cancer survivors, for massage therapists, for healthcare providers of any kind.
Yes. Oh, I love that.
Yeah.
I think that that's great information for massage therapists, particularly if they're not sure what to kind of do, and if they're not comfortable with the treating someone because they don't have enough information. They could go to this website and find someone to refer to, or tell
Yes.
the client about that.
Absolutely. And
So,
I don't know how many people that I started putting this s4om.org on my business cards because I ended up writing it on my business cards all the time.
yeah.
I started printing them with that on there.
That makes so much sense.
It was easier.
I like your thinking. Work smarter, not harder, right?
That's right. That's right.
So going into the education,
Mm-hmm.
what's your knowledge of like the history of what the education has been over the past couple of decades? And you might say non-existent for a while, or misleading. There's
Exactly. You could ask 5 different massage therapists who have been trained at any point in the last 20 years.
Mm-hmm.
And probably all 5 of them will tell you that they were told not to work on cancer patients,
Mm-hmm.
but they all had different kinds of training. And so there was this misconception that massage could spread cancer.
Mm-hmm.
And the reality is that the metastasis of cancer, the spread of any kind of cancer, is such. It's everything is at the cellular level,
Mm-hmm.
and it's such a long process,
Right.
and requires this miscoding in the DNA, and then years and years and years. So us pushing on the skin
Yeah.
is not going to spread anything.
Right.
And people will say, yes, but it can travel through the lymph, and it'll, yes, it can. It definitely can.
Uh-huh.
But mechanically, it does not get spread that way.
Right.
So it was Gail McDonald in Portland, Oregon, was probably one of the first people to start writing articles about her work at Oregon State Health Sciences University.
Mm-hmm.
And basically, the oncology nurses asked her to come up and work on the cancer patients in the hospital. And she said, I don't have it. There's no training.
Right.
And they said, well, we're going to train you. So she learned basically from the doctors, the nurses, the pathologists. I mean, it was just this amazing kind of on-the-job training.
Right.
And then she wrote a book called Medicine Hands. And that really was the first book that would say, we can't spread cancer by mechanical massage. It just doesn't happen that way.
Right.
And that is the text that I use for my class now. And it's in its 3rd edition.
Wow.
And I started out when I was learning with the 2nd edition. And the change from 2009 to 2013, I mean, it was 4 years.
Yeah.
And the 3rd edition of this book it's amazing. It's truly, I always call it the Bible of oncology massage. And we have many other teachers throughout the country. Tracy Walton on the East Coast. We just have these pioneers in our world of oncology massage. I mean, the Society for Oncology Massage was founded in 2007. So
it's the baby.
It's a little baby. And so the misconception that we could spread cancer was debunked. And there's a misconception that you can't receive massage if you're in treatment. And that's also untrue. So that's another part of what the Society for Oncology Massage is trying to set. Like, here's what we have modifications that we make for these people in treatment. We do this for people who are survivors. We do, and I think probably one of the reasons I really love this work is that it's all about critical thinking. It's not like, oh, I do this with my hands and I do it 3 times and then I move on. It's not a protocol per se, but it's about, okay, I'm going to learn some facts and figures. I'm going to figure out what I need to ask. And I'm going to figure out what I can do with the answers to those questions.
I love that so much. I feel like that's what we do in our program here too.
Yes.
And just, I'm not going to teach a student a routine. It's not going to make sense. It doesn't, like, even from Swedish, we teach you the components and you're going to have to, one, figure out what works for you, but figure out for what works for the person on the table as well. And I'm not in the classroom nearly as much anymore, but one of the classes I still do teach is our intro to prenatal massage. And I tell them, like, don't look for me for a routine, because I'll show you a couple of modifications and a couple of techniques maybe you haven't thought of before, but I don't want you to panic thinking, what do I do, when you have the tools, you know what to do. Let's just remember the modifications and the cautions is really all you have to do. So
that's it.
I love that approach.
That's pretty much why I'm so adamant about every massage therapist learning about oncology massage. And part of it is that I worked in a spa for 9 years and I love that work. I love it. And I had been working maybe 2 years, and then I took this class, and that was when I realized, oh my gosh, I've probably worked on people that were cancer survivors, but I didn't know the right questions to ask. And then I didn't know what to do if they said, yes, I am a cancer survivor.
You better not ask. We don't know.
Right. And so that's the thing, is that people say, oh, well, I'm not going to work in a hospital, or I'm not going to make that my life's work. And my answer to that is, you've already seen cancer survivors. You've already worked on them. You just didn't know it.
Right.
And now I think people that have a history of cancer are feeling much better about just letting people know. For a long time, they withheld that information because they were often turned down by people. So they didn't want to go to a spa and then get into all of that.
Right.
That's not why they're there, right?
Exactly. I'm never going to see this therapist again. It does none of their business. I just want a massage.
Exactly. And so that's that's probably my biggest goal, is to get the word out that the spas should be providing this training for their therapists, because they already have those folks coming in. And you don't want to be the person to trigger lymphedema because you don't know what you're doing.
Right. Yeah. Exactly. So for anybody who's not aware what lymphedema is, can you explain what it is in a very simple layman's term?
Yeah, lymphedema is a backup of the lymph fluid that happens when, in the case of cancer survivors, anyone who's had lymph nodes removed or radiated in three main areas. Now, if somebody had a lymph node or three removed from their back, it's not going to be a problem. But if they've had it in the cervical area up here, axillary, which is the armpit, or inguinal, which is the groin. So it's the three main collection areas.
Right.
And if they've had lymph nodes removed and or radiated, the lymph fluid can back up. Then what happens if it's not treated right away? It can become a big infection. All sorts of things can happen. The skin can become very sclerotic. The tissues become sclerotic. But once it's triggered, you have it. It's like a chronically managed condition. And so in general, I would say that breast cancer survivors are taught more about this than anybody else. That's been one nice thing that I've seen happen in the medical world, that the doctors are saying, okay, you have to realize there are risk factors. You know, the people that have had prostate cancer, anything in the abdomen, ovarian, they're not taught as much about this as the breast cancer people are. And so they may not be aware of it. And I tell my students in the foundation class, you now you have to educate your people. You know this information.
Right.
You become the conduit of information for them.
Yeah, exactly. And make sure they send them to the Society of Oncology Massage website. I'm catching on.
Yeah. And my other favorite website that I put on the back of my business card was lymphnet.org.
And I have that one too.
Yeah, there we go.
So, yep.
The National Lymphedema Network is this incredible organization that helps people that do have lymphedema deal with it. And they have, once again, it's like a repository for lots of information for therapists, for patients, for healthcare workers. And they have position papers. And what I really like is a lot of their stuff is in two languages, English and Spanish.
Oh, that's wonderful. I love that.
So they really have that covered now.
That's great. Both organizations, that's wonderful that we have that help to direct us. And we have actually, ASIS has a sister school out in Florida called ACLS, which is the Academy for Lymphatic Studies. So they have a full training programs and stuff for that too. So today it just came up in conversation again with a student and totally unrelated to our conversation. I'm like, yeah, I actually do know lymphedema class. Right. That's really, really interesting. And I do like that you mentioned about us being educators too. And that happens a lot with our clients, that we're teaching them about their bodies. And what you said on the very early, when you got back into your body, when you were talking about your treatments, getting massages with David, I think that's also what we can help with our clients. And do you see that more even for people who have undergone a lot of treatments and have gone through cancer? Is that now they're kind of discombobulated and massage is helping them kind of connect again?
Yeah, I really think of it as integrating all the parts, because what happens when you are diagnosed with cancer is the way everyone looks at you in the healthcare system is breast cancer, prostate cancer, testicular cancer. You know, it's like this one part of your body that they give a lot of attention to, right?
Right.
And then, you know, someone will be worried that they can't get a massage, so they wait and they wait. And when they finally get on a table with a properly trained therapist, there's just a lot going on because they just have not had attention to the whole.
Right.
And it is one of the reasons that I love massage therapy, is just our ability to be a facilitator.
Mm-hmm.
So,
Mm-hmm.
you know, I don't like to use the word healer. I'm not healing anything. You know,
No.
people are the only, you know,
Yeah.
individuals can only heal themselves.
Yeah.
But I can facilitate having them realize, oh yeah, my big toe is related to my pinky. You know?
Yeah. Yeah. Exactly.
And it is true. Cancer survivors, everything is about that one area.
Mm-hmm.
It's a lot of attention, but
Yeah.
you know, nothing else does.
Right. Exactly. Oh goodness, that's it. Gives me kind of goosebumps that we have this. We do have a power in us. We're not healers, but there is this greatness that we can bring and spread in a good way to lots of people and make them feel whole again. I think of it too with our elderly population and bringing touch to them as well. And you know, they're not. That's probably one of the most underserved populations that we have, and so the work is out there and needed 100%.
Absolutely. I have always said that if everyone got regular massage, the world would just be happier
Yes.
and a lot more peaceful.
Yes. Absolutely. 100%. I'm behind that because massage makes me happy.
Yeah, right.
Exactly. So we were talking before we started about some of the things that there's misconceptions now even, and one of them was forgetting that the post-treatment patients need special considerations as well. Can you expand on that a little bit?
Yeah, so that fits into the people that are at risk for lymphedema, because it's those folks who have a lifelong risk that will need modifications to their massage the rest of their lives. And when I teach the foundation class, we have this 1-page intake form. And I can see the minds of the people that work in spas saying, I don't have time for this, you know?
Yeah.
And so, and because I worked in a spa and I know we've got 90 seconds to like find out what they want that day, you know?
Yeah.
And I have 3 questions that I ask, you know, are there any medical conditions? You know, do you have anything you want me to focus on today? And have you had any lymph nodes removed and or radiated? And then from there, if they say yes, you can do a really quick intake where you just find out what kind of treatment they had, when was it. I don't know how many people have said, yeah, that was years ago. It's okay now.
Yeah.
And then I have to very gently and kindly say, well, yeah, you know, but because of this, you know, radiation, they didn't take any out. Because of the radiation, which damaged the lymph nodes under your arm, we're going to just do some basic modifications to make this massage safe for you.
Right.
And that's totally doable in the spa world. And I know that because I did it for 9 years.
Right.
So it's those folks who will need modifications later on. And people that have had radiation have other concerns, like all the structures underneath your bones become brittle. Let's say it was in the hip area. Well, you're not going to want to be wailing away on them with really deep pressure.
No.
If they have more brittle bones because 10 years ago they had radiation in that area.
Yeah.
So it's mainly the risk of lymphedema, which is that concern for long-term survivors.
Okay. Yeah. That's really, I never, of course, because I'll be honest, I haven't had in-depth oncology training before. So this is all great information. I'm thinking of all the things in my head that I'm like, I need to know all this.
Right.
And I
Well,
want to
you
know
can come
more
take a
about it.
class.
Yes, exactly. Exactly. Do you find that like long-term survivors or that have been out of treatment for a long period of time, that they're still connecting with their with their healthcare providers to check on things like that, like with the bone mass and things like that?
No, it's really interesting because in general, if they've had a surgeon, they will be followed up for about a year with that surgeon. If they had an oncologist who did chemotherapy, same thing, they'll follow up after the treatment is done for about a year. And I don't know how many doctors have said to me, well, none of my patients have gotten lymphedema. And I said, are you following them?
Right.
Are you seeing them 10 or 15 years later? And they're like, well, no.
Right. Right.
And so they're not told to follow up in that way. That's when I send them to these two websites. And they can always have their primary care physician like ask for a bone density, you know, stuff like that. But it really is like we're educating them, then they educate themselves. But it's they're not being followed unless they have like a stage 4 cancer or a cancer that is, you know, watch and wait, which is some of the leukemias, you know, and so they might be followed, but
yeah, it's not everybody, for sure.
It's not everybody. And there's the, you know, there are the people that say, I'm over that. I'm not going to talk about it anymore. And there are the people that are, yeah, I'm a survivor, and they take on the warrior.
Right. Rightfully so, for sure. Yeah. Nothing's going to stop them now. Yeah.
I always congratulate them when, you know, somebody comes in and says, yeah, I'm 15 years out. And I'm like, party.
Yeah.
That's awesome.
Yeah. But you as a therapist are still keeping those things in check. And that's what's most important. Yeah. So, yeah. So speaking of the doctors, have you ever seen any resistance of working with the doctors or getting misinformation for the client to get quote unquote permission to get treated, those kinds of things for massage?
Yeah, that's a tough one. I think that because physicians are such specialists, any physician really is. They have their basic, you know, training, and then they just go down a path that is very, very narrow. And they have to. I mean, cancer is like 200 different kinds. There's no way that somebody can know all of them. And so it depends on how old they are. And if they've ever experienced massage themselves, I find that's an important thing. But I'll tell you, the thing that I find most often is they think that massage is fluff and is not a problem. There are those in that category that just think, oh yeah, sure, go get a massage. Okay, I'll tell you this story. I had a guy on my table who I was saying, you know, I'm going to make some modifications. And he reaches over and calls his doctor.
Oh my gosh.
He said, tell this therapist that she can do deep tissue on me.
Oh my goodness.
And I get the phone. Hello, doctor. And I'm in my treatment room. The guy's
wow.
And I said, okay. And I said, well, would you be open to having me send you some information about oncology massage? So I love these situations because it's an opening. It's an opening for me to send them information. And I say, thank you very much. And then what I tell the client is this. I have a professional responsibility, a moral imperative to do no harm.
Right.
And so I'm going to do what I know is the right thing for you, and I hope you enjoy your massage.
Right. Yeah. I
And
love it.
really
Yeah.
and truly, I think I've had 3 people in the last 14 years that have been like that. The rest of them are like, oh my God, this is wonderful. I'm so glad you told me.
Right. Yeah.
So
That's good.
you've got the physicians that think, okay, it's not a problem. You can do anything you want. You know, then there are the other ones that are like, no massage ever, because they still think that it spreads cancer, even though they know that it's not true.
Right.
You know?
But better be safe. Yeah. Not do it. So,
And so when people say, well, I have a doctor permission slip, I'm like, that's great. You know, that's fabulous. And here's what I'm going to do. I'm going to make these modifications. Oh, well, it says here without any, you know, whatever. And I still am going to make the modifications I know are the safest thing for them. And I always ask if I have permission to send information to their doctors and let them know let their doctor know I treated them. And these are the modifications I made because ...
Right. Right.
So,
That's so great. I love that you teach that. I love that you say that. And it's one of my pet peeves I see. I don't know if you're on, I know you're on one of the Facebook groups that we're both in, but I see sometimes in some of the Facebook groups, people say, just get a doctor's note. Just make sure you have the doctor's permission and do X, Y, or Z. And it's not always oncology. It could be on anything and everything. But the doctor's not there in the room. The doctor's not the trained therapist. The doctor didn't take a specialized class on this. And, you know, you don't know the whole story. And ultimately, you're the one who is responsible because you're doing the work too. And so I love how you explained how you handle it because it's very professional. It's not stepping on toes or going against the doctor's orders or anything like that. It's just presenting the information in a way that's clear and makes you look super professional and like you know what you're doing. So I'm going to have to make sure our students watch at least that part every time we talk about this. Like, listen to this. If you don't believe me, listen. So
listen to this other teacher.
Yeah, exactly. And it opens that door not only for more marketing opportunities, right? That you're handling their patients with utmost care, and you have their well-being at first and foremost priority. I love it.
I think that's what's important. And here's the other thing to remember. I mean, and you said it. The physician does not know the kind of training that we have as massage therapists, just in general. So when I remember a colleague of mine in California, she was sitting on this committee with a bunch of physicians at USC Cancer Center. You know, it was a big deal. And she said, well, I'm just the massage therapist. And I said, no, you're the massage therapist professional. You're the only one who knows what we do.
Right.
You are the master of what you do. They're the master of what they do.
Right.
So you're not just the massage therapist. You're the only one who can explain to them.
Yeah.
This is what our training has been. This is what our postgraduate training has been, specialized training for oncology patients. This is what we will continue to do. So we need to realize that we're not just the massage therapist.
Right. Exactly. I love that.
We're the one who's got the training.
Yes. Absolutely. And we need the specialized training. And I want to find out all about yours. So we talked about it. It's a foundations class. And even though it's just foundations, it's 24 hours, right? 24 hours of content. That's just, I can't imagine everything that you cover. I know we talked about a few things, but what are some of the highlights that you cover over the time, or how's the structure? I know they get to work with real life people with cancer as well. So that's really exciting to get to put it to use right away.
This is the part that I love the best, is day 3. So it's a 3-day class. And it's really intense, and I think that's a good thing. And it can be kind of crazy making for 3 days, but NCB requires that we do it in a row. Because I've had people say, "Oh, let's do 1 day a month for 3 months,"
Right.
And we can't. So it's 3 days, and we cover all the major treatments that the Western medical model does. We're not going to get into alternative treatments. We're not going to get into all of that. There's too much to cover. So chemotherapy and the side effects, surgery and the side effects, radiation and the side effects, because basically what we're working with are the side effects of the treatment. That's mainly why we're modifying the massage. And one of the things that I love in Gail's book is it doesn't matter what kind of thing you do. It's just to know how to modify it for the client that has low blood cell counts or, you know, a higher risk for DVT because they're in treatment. So we cover those 3 things. We cover all the modifications for someone who's been at risk for lymphedema. So that's kind of like the bulk of day 2 is I'm there giving different scenarios. And we're doing hands-on, you know, work, practicing on each other, and then, you know, coming into, I don't know, maybe 10 different scenarios. So it's pretty inclusive.
Great.
And then on the 3rd day, we have 2 separate client clinics where I've gathered cancer survivors that will come in. You get to do an intake, you do a 60-minute massage, and then you get a little feedback from them. And so each clinic is 90 minutes long, and we do 2 of those on day 3. Then we have lunch, then we come back and we do a whole round table where each person, I usually have to pair up people because we can't have all that many, you know, people in a room all at the same time, you know. So usually it's 2 students to a patient, and you guys just figure out how you're going to do that, you know. And then we do a whole round table where each team talks about, okay, we had this person, they had this treatment, and these are the modifications we made. And then people can ask, oh, well, so wouldn't you do blah, 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 or, you know, and so it just takes you, you know, full circle. And what I really like is that for the first clinic, everyone's a little bit on edge and kind of nervous. And then by the second one, they're like, oh, yeah, we have this.
Get that empowerment. I love that. So it's like a Swedish-based treatment, right?
It really is. It's and this is why I think it's great if estheticians take it, because they do a lot of Swedish massage, especially on the décolleté. And so there are, for breast cancer patients, there are so many modifications to not sweep into the, you know, the aftercare. And so, but yeah, I think in general, what we're talking about are Swedish massage modifications, but even people that do tuina. Okay, so can you lighten up the pressure on your tuina? Is it possible to slow it down a bit? You know, I mean, and that's where it's, I think, so universal, is that just figure out what you need to do that fits within. We have a framework of pressure and site and positioning considerations.
Okay.
And so you talk about the pressure, you know, in this area, we're going to do such and such a pressure level, you know, the rest of the body, if they're a survivor, yeah, we can, you know, they just ran a marathon. They're probably going to want their legs worked out.
Right.
And we utilize in the surgery section, I do a pretty in-depth dive into the breast cancer surgeries and the reconstructions, because 50% of the people that we see are going to be breast cancer survivors. So these people are going to walk in and they're going to say, oh yeah, I had, reconstruction. And it's important for us to know what kind. Did you have the tram flap? Did you have implants? Did you have the deep flap? Did you have,
Right.
And so we're learning the whole thing. It's awesome.
That's
awesome.
so great. So I have, let's see, the upcoming date's July, right? Is this correct? July and then November?
Right. So July 28th through the 30th. And right now I do have space in that class. That class we're still keeping at only 6 people.
Okay.
We're just still being careful because of COVID.
Right.
And also because of bringing in the client volunteers.
Right.
That's a big concern, especially if they're in treatment, they're going to be immunosuppressed. We just need to make sure we can do absolutely everything. Yeah. And then I'm optimistic by November.
Yeah.
Yay!
Yeah. I did tell Mo, because you're over at the Tucson Continuing Education Institute, right? So Mo Tate, the owner there, I did tell her anytime if the space seemed like a little cramped for you guys and you wanted to expand your numbers, just let us know, because we're right down the street there to help out with the space. So we'd be more than happy to do that. So I'm going to put up your website here. That's where they can find out more information about your class.
That's correct.
And that also leads you to, and they can also check out the Tucson Continuing Education Institute as well, that has other classes too. I just want to make sure that we had that on there. Let's see. What would you say to anybody kind of on the fence of whether or not this would be their right for them? What do you think?
Well, here's what I like to say, that I still think everybody should take the class. And I have had people that after we're all done, the class is all gone, and they come up to me and they say, I don't think I can do this. And I say, that's good for you to know. That's great. You know what needs to happen. And if you don't feel comfortable with it, that's great. So I still think, first of all, you're going to get 24 CEUs and you're going to have the knowledge, and maybe you're unsure at this point, but maybe you can do it later.
Yeah. But even like you were saying that, and I tell this to my students in our prenatal class, because they don't have a choice here. They all have to take it. I said, I don't want everyone here to say they're going to, put it on their website when they get out of here and they're prenatal therapists. That's not for everyone. Absolutely not everyone. But consider for a moment, you have a long-term client who gets pregnant. Do you want to know if you can treat them or not, or refer them out and those kinds of things? Exactly. Or do you want to know when it's your turn to be like, no, I can't do this, and know when to refer out? And so just having the knowledge that you learned in your class with, can I ask those questions, especially the 3 that you usually ask, and know, yes or no, is this going to happen or not, safely, right? Because
absolutely. Yeah. And because we always want what's best for the client. And we want to know what's best for us in how we feel treating any client. We have to feel confident.
Yeah. They'll know the difference for sure if it's not confident. Yeah, 100%. Yeah, I think so. That's such good information. If do you have advanced classes for people who have done the foundations class?
I do. So I have an advanced oncology massage class. It's another 3-day class, and it's also 24 hours, a little bit more hands-on. And I usually like to have people spend about a year in between taking the foundation class and then taking the advanced class, so that they can get their hands on people and just start to get some experience. And then that's what drives them to maybe take the advanced class because now they've got questions.
Yeah. That's great. Do you cover any kind of like marketing things too in it, or how to approach organizations and things like that?
In the second class, yeah. In the advanced class, there's a whole section on marketing and how you want to present yourself and how to do that.
Yeah. I think one of the hardest things we have as massage therapists, and how to sell yourself. You're like, I'm just so nice and humble.
Right, exactly.
Yeah, we have to teach everyone, no, get out there and tell them what you can do and own it. So yeah, absolutely. So I as we're starting to wind down here, I want to be respectful of your time. I want to recap some of the things that we were talking about. So if people have joined us later, wanted to remember that the Society for Oncology Massage, S4OM.org, is a great resource for anybody, therapists, patients alike, for more information on the oncology massage world. And then also we had the National Lymphedema Network at lymphnet.org, take after Jacki and put them on your business card so you don't have to write them down every time. So smart. Jacki's class is coming up July 28th to the 30th, and that's going to be down in Tucson at the Tucson Continuing Education Institute. And if you're interested in signing up, go and check out our website at jacki-sellers.abmp.com. So I want to make sure everyone had that information. Is there anything else you wanted to say before I ask you the fun questions at the end here? I don't want to let you get away with that. I thought you were off the hook.
Dang it. No, I really appreciate the opportunity to talk with you, Michelle. It's really been great. Thank you.
Yeah, thank you. So I learned a lot, and I want to learn more. So I'm really appreciative of you taking out the time and sharing so much of your knowledge with us. So, and now we're going to share these answers.
Okay.
So here's our hot seat questions. All right. Which talent or superpower would you like to most have?
X-ray vision.
X-ray vision.
Doesn't every massage therapist want to just look at the body and see the bones, see how everything?
Yeah. Oh, that sounds like we just were having a conversation about this. I mean, we're like, I want to see what are the layers?
Right.
Yes. If you weren't in the massage field, what occupation would you most like to have?
I already did it. I was a professional musician for 40 years. It was just awesome.
I love it. That's awesome. Side note, is there anything like on YouTube or anything of some of your performances where we can find you?
I don't think so.
Okay. All right. Now I'm on a mission. I'm going to see if I can find it. Okay.
You can probably Google me and find old pictures of me with a horn. But
that's fun. Great. If money and circumstances weren't issues, where would you most like to live in the world?
6 months in Hawaii and 6 months in Santa Fe.
Nice. Both great places, and very, very opposite in many ways. So,
right?
Yeah, love it. What's your most treasured possession?
This was a hard one.
I know everyone has the hardest time with this one. It's one of my favorite answers.
About, like, possessions. So I kind of had to come up with this, but so picture of me and my mom at Disneyland. When I on the merry-go-round when I was 23, she took me to Disneyland before I had knee surgery. It was like make a wish. We were gonna
your last hurrah before you had to be out.
And my medicine hands book, which Gail signed and put a nice personal note to me in 2013 when it came out.
Oh, wonderful. Yeah, what great work that she does. I love both of those answers. I like it's a little personal and little professional stuff. And last but not least, what would you tell your 18-year-old self?
Oh, poor naive little Jacki. I would say, honey, it's okay to be gay and you deserve to be loved.
Oh, yes, you do. Yes, you do. I love it.
I didn't know that when I was 18. So.
Yeah. Though we're really dumb when we're 18.
No kidding. And we think we know everything. So.
Exactly. That's the worst part of it. It's not even that we're blissfully dumb and just having a good time. We think we're the smartest. So well, thank you so much, Jacki. You made me had a great laugh today and a good time.
Good.
And I hope we can connect again, and I'll share your information, your classes, with our students who are really interested in it, and we'll see each other again. So thank you so much, and thanks to everyone who's watching. Appreciate
Thank you
it.
all.
See you
Thank
next
you,
week.
Michelle.
You're welcome.